Hi. Are you a midlife woman struggling with hip pain? You are not alone. In fact, it's one of the most common joint complaints I hear from my midlife female clients. Yet sometimes we're misconceived. We think it's hip arthritis or just tight hip muscles. And so what do? We stretch and stretch and foam roll, and it only gets worse. Well, what we're here to talk about today is another common hip dysfunction called gluteal tendinopathy. In fact, 1 out of every 4 women over the age of 50 has it. So we're going to talk about what it is, why it happens, what are the common symptoms, and what are 3 top exercises you can do to help manage it. And before we dive in, I do want to make sure if you have any type of hip pain or discomfort, it is always best to get it assessed so that you know exactly what you're dealing with so you can best manage and treat it. But if it is gluteal tendinopathy, that is a degenerative condition of the tendons that connect your hip muscles to your hip joint. Now, when I talk about the muscles, we think about the gluteus maximus, right? The biggest muscle of the butt, which is going to be more of that hip extension or press back. I'm talking more about the gluteus medius and minimus. Those are smaller gluteal muscles that lie beneath the maximus, and they're more responsible for hip abduction, so side or outward rotation. So why does this happen? We have estrogen receptors everywhere in our body. When we start to lose estrogen in midlife, we start to have joint concerns and dysfunction. In this case, gluteal tendinopathy. Also, we lose muscle and our muscles become weaker if we're not doing something about it. But especially in those deep gluteal muscles that we're talking about, the medius and the minimus, because we just don't actively use those in normal day-to-day life. Also, we overload and we use poor mechanics, meaning we push through pain. So we're gonna walk without taking a break or trying a different activity. We might overstride. We're taking too many stairs, too many hills. We are overtraining and under-recovering. So again, we're just not changing up the activity or taking some time off overall. We're crossing our legs. We have weak core and glute muscles. So what are the symptoms that you're gonna potentially experience? Outer hip pain and or achiness, and that can travel down into the upper thigh. Pain at night when you're lying on the affected side, so that disrupts your sleep because you have to shift positions. Pain when you're taking stairs or doing hills, or pain and instability when you're standing on one leg. Okay, let's talk about the 3 exercises to help you train those deep gluteal muscles and help lessen that pain and achiness from gluteal tendinopathy. Come with me, we're gonna go down to the ground. Okay, the first exercise is a glute bridge. So we're gonna lie down, feet are about hip width apart, arms are down by your side, flatten your back, so you're gonna press your belly button in, lower back down, just lift the hips. So we don't wanna be arching the back, we want a nice straight back, and then you're gonna lower. So you're gonna inhale for 3, 2, 1, squeeze the buttocks at the top for 2, lower, 3, 2, 1, up, 3, 2, 1, straight back, hold, 2, lower, 3, 2, 1. You're going to do this 2 to 3 sets of 10 reps is ideal. So take a break in between each 10 reps. The next one is going to be a side lying leg raise or a clamshell. So I'm going to start with the side lying leg raise. So we're just going to lie down. We want to make sure you can bend the lower leg. You want your hips stacked. So we don't want to roll back. We want to be hip, hip, and ground. So you can hold on here. So upper leg just lifting up and down. So again, remember those deep muscles, the gluteus, medius, and minimus, they are going to be trained by this side movement. Now, if you can, maybe that's too easy. Initially, it's probably not, but if it gets to that point where it's a little easier for you, you can add a little resistance with the band. Again, make sure your hips are stacked, you're not rotating backwards. Up nice and controlled. So again, 2 to 3 sets of 10 on each side. Okay, so that is 1. Another variation, I'm going to turn over, is we're going to do a clamshell. So again, hips are stacked. In this case, both legs are bent, and you're just gonna lift the upper leg. So this is that outward hip rotation. And so again, depending on where you are in this journey, start without any resistance. Maybe you do the clamshell first, then you do the straight leg. You decide what your body can handle. 2 to 3 sets, 10 reps, okay? With or without resistance. You want to do the same thing on both sides, even though one side might be the problem, okay? Because we don't want to create an imbalance. So I'm going to keep that band on. Now this time we're going to put the band below the knees, so on the lower legs, and you're going to do a side walk, which how often do we walk sideways? So you're going to do about 10 each way, and so you don't have to bring your arms up like I am, but you're just going to go side to side. Keep your toes forward. You really want to do that. Sometimes I'll bring my heel out just a little bit, and then my toes out a little bit, so kind of feel where you get into that deeper hip muscle. So oftentimes I can feel it more if I just outward rotate a little bit, but otherwise keeping those toes more forward. Same thing, maybe you just start without resistance, and then you add resistance as your body is able. So those are the 3 exercises. If this resonates with you, I encourage you to subscribe to my channel, continue to follow my content, share this video with another woman that you know who's dealing with hip pain, and drop me a note. Let me know what you've been dealing with and how you managed it. Because not only will it help me help others, but others who are watching this video can also learn and benefit from what you have done. We all learn from each other. And I look forward to seeing you in the next video. Bye.